are here with Nicolette Visser, the Chief Wellness Coordinator at Reality Wellness Group. Thank you for a very interesting presentation, and it's really nice to meet you.
Nice to meet you too.
Just a couple of questions based on the information that you shared with us today. First of all, regarding the mental health in the workplace, how do employers address mental health in the workplace while balancing the demands and the pressures that are on them by their clients, finances, production rates, etc.?
So I think that's always a tricky sort of answer, to give, because the fact of the matter is you got to look at what is the business like, what is the business dynamic. Once you've considered the business dynamic, then you got to look at, well, what would be reasonable accommodations to sort of teach people to take ownership of their mental health, but at the same time allow for the business directive. But the fact of the matter is, and the truth of the matter is, that mental health is becoming a business problem because it does affect performance, it does affect engagement, it affects a number of different factors. So if we're not necessarily willing to for example, create a wellness policy around mental health, if we're not willing to have these conversations and sort of normalize the conversation of mental health, then we're going to have teams who are not necessarily mentally or emotionally present. So I think as a first step is to look at what does the business need, and then to look at, well, what are our wellness policies and what do they look like? From the wellness policies, then deciding, okay, well, what will work within my business, and can I keep re-updating them every single year? And that can be in the form of like evaluating the needs currently, and then from evaluating those needs, then deciding, okay, how do we sort of reevaluate that and update that policy. Hope that answers your question.
No, it does. It does. Something that then adds to the first question is, how does an employer control the possible abuse of the employer's goodwill to address mental health, but possibly having individuals in the business that feel here's an opportunity to get a couple of hours off work. So maybe I could be diagnosed with a condition, or at least I need to go and see a doctor or a psychiatrist, but that's a half a day off work. So how does the employer control that?
Okay, so when it comes to, so we spoke about having a wellness policy. Within that wellness policy, if you start to engage on conversations around how long should it take for someone, for example, to go for a therapy session, how long should, let's say, for example, going for an evaluation with a psychiatrist take, those are things that the business should be aware of and understand. So that's for the first part. The second part is we need to sort of go with the idea that we do trust our employees. People will take chances. We're not going to dispute the fact that people will take chances, and it happens. But then it's about having consequence management as a result of that. So if you don't have a policy, you can't engage on consequence management. If someone is taking a chance, how do I know they're taking a chance? It's by me being informed on what is actually needed when it comes to sort of issues. So for example, if I say I'm sick and I need to be booked off by the doctor, you know that a doctor's appointment should take me about an hour to go to, obviously taking travel into cost, right? If it's something that I can't be booked off for, then you'll know I'll be back in the office in the next couple hours. But if I'm off half the day, then you're going to start asking that question, why? And then you look at, was it at a clinic and things like that. But I think it's understanding, what does that mean? If someone is going to a therapist, how long does it take? What does that mean? And if people are taking chances, then what is the consequence of that?
So really, taking a practical approach to it. But as you've mentioned, trust is probably the most important factor in that regard as well. If we look at mental health and the awareness of it in South Africa currently, how would you describe it?
Mental health in South Africa is definitely a contentious one. And I say contentious because people don't want to talk about it. I think there's a lot of cultural differences as well. We do have the issue that some cultures do not believe that it's something that affects them. We have also gender differences and a number of different factors. And so if you look at mental health in South Africa, there are very specific mental health disorders that come through in the country based on the sort of existence that we live. So, for example, PTSD is actually a really high mental health issue that happens in South Africa, obviously because there's a lot that happens, just from a realistic point of view. But what's interesting is that we're not willing to talk about it. So someone goes through a hijacking on the way to work. Do we give them the space to process that? Do we give them time off? Or, what is the policies that go with it? So I think it's a very important topic to talk about, but I don't think we talk about it enough.
That's going to take me to my next question, which is, what do we do about it? Because I was expecting your answer, but as a contentious issue, surely there should be something that can be done about it. And what is your opinion on addressing the issue?
So, for me, if we're talking from a business point of view, businesses actually need to take ownership of wellness policies related to that. I think one of the challenges and this is just a personal opinion, is that when we look at mental health, it's not necessarily included in legislation, and obviously a lot of businesses go the bare minimum. When it comes to their contracts, their company policies, it's usually based on the Basic Conditions of Employment Act, Equity Act, all of those kinds of things, but they don't necessarily take other aspects into consideration, that it's not just the bare minimum that we need to be considering for our employees. There's more to it. So I think what we really need to do is, if it's someone, for example, a CEO or director listening to this, is to say, how do I take ownership of the mental health and the psychological safety of the people within my business as well as myself? And then can we extrapolate that to other businesses, to small businesses, to large businesses? So I think it's just taking ownership, really.
So earlier we discussed trust, and we've made mention with regards to employers taking accountability in getting the necessary policies and structures in place to support their employees. A large percentage of the workforce in South Africa are blue-collar workers. A lot of them, like we discussed now, will probably work for employers where policies such as these are not applied. So where do they go for help, especially in cases where they don't have the necessary medical aid to afford a psychiatrist, or they don't have the means to afford a psychiatrist? Where can they go for assistance?
I think you touched on a really important point, is that, and I think it touches on a question that you asked earlier about mental health, is that mental health is inaccessible to a lot of people in South Africa, and you're right. The fact of the matter is, a lot of people can't afford it. It's expensive. If you're looking at the cost of a therapist, you're looking at about anything between 800 to 1,200, even more, which that is already half of someone's salary in some instances. But in those instances, it's important to be mindful that there are resources that are free for people to go get assistance. So we've got a lot of NGOs who provide psychological support for free. For example, you have SADAG, who's quite well known. So that's the South African and Depression group. So basically what they do is they give you free counseling. They've got a suicide hotline and things like that. You've also got other places like FAMSA, for example, who also provide support. So it's about looking at what psychological services are within my community and what is actually available to me. You might not necessarily, for example, get medication, but you can get it through a GP. So going to your local clinic if you've been diagnosed by someone, etc. So that's one of the tricky parts. The other thing is, where we talk about ownership from a business point of view, is businesses should have an EAP to support their employees, especially for employees who are blue collar and can't afford these services.
It's a really interesting topic, and I would wish that we would have enough time, or more time at least, to discuss it further. So maybe I'll invite you to an interview for the channel itself. But thank you for your time today, and again, thank you for the interesting presentation as well.
Perfect. Thank you so much, and thank you for having me as well. And looking forward to it. So just give me a call.
I'll do so. Thanks.